Hey, hello everyone, and welcome to yet another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with your dentist is an initiative to increase oral and dental health awareness among people. Visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And in conversation with me on the Tooth Talk in the Kid Care series, I have Dr. Premila Naidu. To give you a brief introduction about Dr. Premila Naidu is the founder and director of SmallBites, an exclusive dental care facility for children. Dr. Premila is a multifaceted personality who seamlessly assumes varied roles and responsibilities in life. She has over 20 years of experience in preventive and pediatric dentistry and has worked with renowned hospitals in Bangalore like the Fortis Hospital and the Narayana Hrudayalaya. She has her bachelor's from the Oxford Dental College, Bangalore, and did her master's in pedodontics from Oxford Dental College, Bangalore. Her passion for dentistry and love for children drove her to start SmallBites, an exclusive dental clinic for kids in the year 2007. Apart from dentistry, Dr. Naidu is a fitness enthusiast and also enjoys photography and biking. Dr. Premila, thank you so much for joining me again on another Tooth Talk with your dentist conversation, and a warm welcome to you.
Thanks a lot, Dr. Rekha, for having me.
So, Doc, what do you think about? I'll just get straight to the topic. Considering a lot of parents probably see notice some kind of a difference from the way they have grown up to the way their children are growing up today. So, to an extent, probably we can say that is an evolutionary trend. So, what do you think? The growth of teeth would be in the growth and development of the face and the jaws of a child?
Okay, Dr. Rekha, let's start with the teeth first and then slowly move to the jaw and how the growth of each one starts. It's interdependent. Okay, yes. So when we talk about milk teeth, the milk teeth start falling somewhere around 5.5, 6 years. That is the lower front teeth. But the last milk tooth to fall is usually the upper canines, which fall around 12 years, 12 to 13 years. So this whole transition of milk teeth to completely permanent teeth takes around 6 years. Yes. And this 6-year period is called as the mixed dentition phase, where there is interchange happening. There are some milk teeth, there are some permanent teeth, and it's a very dynamic stage in the growth of the jaws as well. Because if you see, the permanent teeth are much bigger.
Yes.
And the milk teeth were much smaller. So this is actually one of the most common thing parents also ask, the milk teeth were so small, so cute, all well aligned. Now the permanent teeth are so big and, they're not aligned. They're looking odd and things like that. But the permanent teeth, are actually made for her face.
Yes, I think generally these kind of questions come when the child is 7, 8, 9 years old. When the upper front teeth are the kind of, they come and they look really big for the child's face. Considering they would have seen smaller milk teeth. And I think also one common thing parents ask us is about the spacing in milk teeth. They say, why does my child have gaps in the milk teeth?
Yes. So gaps in milk teeth are yes, it's asked about, but they are actually good. We need these gaps because the permanent teeth are going to be much bigger. So these gaps make sure that the permanent teeth are able to align. Of course, there's a lot of jaw growth that is going to happen during this period. But again, these gaps which are there in between two milk teeth also help in the alignment of larger permanent teeth. And the one more thing that is important is, each milk tooth which is there occupies the correct amount of space that is required for the permanent tooth. So this comes from a point of view because a lot of time we get asked, is removing the tooth the easier option or a less painful option for the child? But each milk tooth occupies the correct amount of space for the permanent tooth to come in. So if it can be treated and retained, that is the best thing that we can do. but sometimes the tooth is so extensively damaged that we might have to remove it. In such situation, we will have to retain the space using a space maintainer.
Yes, yes,
So that is how each milk tooth plays a very important role in the permanent tooth eventually coming in and the jaw growth,
yes.
Dr. Rekha. So that age is very dynamic, and I really suggest that parents should get the child checked once in 4 to 6 months, even if everything looks fine, just
Normal.
to look at how the jaw growth is happening, and is it
Yes.
in sync with what is normal, or should we intervene at this age or not?
Yes, yes, yes. I think that would be what like how we would say that is a milk teeth age. Like at 3 years when the child has all his milk teeth, and then subsequently, like you said, by the time the child reaches around the 6th year, some of the teeth begin to fall, and some of the adult teeth start coming into the mouth. I think one more very common thing we get asked is why is especially I think the lower front teeth, generally the adult teeth come from inside to then out. So probably sometimes the adult teeth come out a little before the milk teeth falls off. I think that's again one area generally parents are very concerned about.
Yes, that is an area parents are concerned about. That's called as the sharp teeth, where there are two layers of teeth. So, two things that parents are worried about: whether the milk tooth needs to be removed and whether the permanent tooth will align itself. So, there are certain self-correcting malalignments. So, this is one of them. The permanent lower incisor tends to come from behind and slowly push the milk teeth. So even if it is behind now, with the swallowing and tongue continuously pushing it, they tend to align. So there is no urgency in going and pulling out the milk teeth. We can follow it up and hope that it would fall off naturally, than being too, extracting it early. And
Early.
one more thing that we usually come across around that time, that is 7, 8 years, is that the upper teeth start coming, and they
Yes.
are quite big, and
Big.
they are spaced out.
Yes.
Usually, when they come, they go like diagonally to each other. So that is an thing that parents ask, that the milk teeth were so small and nice, and now the permanent are so big and out of place. So that is also self-correcting. So when the canines come later, around 12 years, they push all the four teeth together and align it. So there are a few self-correcting malalignment like this, which are a normal part of the growth, and there is usually nothing to worry.
Very, very, yes, yes. I think some of them are self-correcting anomalies, like we can call them, but they are good for the child. Like you said, spacing between the milk teeth, and probably like the tooth coming from the inside, pushing it, and then coming into a proper position. But Dr. Premila, sometimes what happens is there is some amount of what we call as abnormal growth that happens. Like abnormal in the sense something that is a deviation from the normal. So, what are the kind of deviations that we would find that is happening from normal, and why do these deviations happen?
Okay, first coming to the cause of the deviation. Why is there a problem with the jaw growth, which otherwise was supposed to grow in a proper way? First thing is to look at habits, doc. Like if there is a habit of mouth breathing, thumb sucking, pacify sucking, all these habits also, put abnormal pressure, which makes the jaw grow improperly. And then genetics is also reason. It
Yes.
causes 10% of abnormal jaw growth. Then when the front teeth, the child loses the upper front teeth and the permanent teeth comes, so that gap child might learn an abnormal way of swallowing, what we call as tongue thrust, or otherwise also the child might have a tongue thrust habit. So all these play a significant role in causing improper jaw growth. Now coming to the jaw growth per se. So we have an upper jaw and we have a lower jaw. So the upper jaw always grows first, and then the lower jaw grows. That's how it should happen. But sometimes what happens, the lower jaw is ahead of the upper jaw. So, the lower teeth, the lower front teeth are ahead of the upper front teeth. So this is improper jaw growth. This is what we call as the class 3 malocclusion, and these need to be corrected earlier itself. As soon as we see it, it needs to be followed up and corrected. And the upper and the lower teeth usually should hardly have 2 mm gap between them. But sometimes the upper jaw is growing too fast and the lower jaw is not able to catch up.
Yes,
So the
yes.
gap between the upper teeth and the lower teeth is a lot. So this is
Yes.
called as class 2 malocclusion, where we need to help restrict the growth of the upper jaw, at the same time help the lower jaw catch up. And one more common thing that we see in children nowadays is the jaw size being smaller.
Yeah.
So like remember earlier we were speaking, the parents are concerned when the upper two teeth come spaced out. That is
Yes.
good.
Good.
But when they come in sync or when they are overlapping, it is a clear indication that the jaw is small.
Wow.
So at that time, we might have to help the child with an expansion, removable braces to expand the jaw to create the space. And one of the other jaw correction or the teeth alignment thing that needs to be started as soon as it is seen is when the teeth are in crossbite. So the upper teeth is always ahead of the lower, but even if one upper tooth goes behind, it will not let the jaw grow properly. So in such situation, crossbite correction is something that we suggest that, as soon as we see it or we see a developing crossbite, it is better to correct. At the same time, when it is related to habit, it becomes even more important to correct the habit first.
Yes.
If I'm not going to correct the habit, how much ever I align the teeth, later it is going to be back to square one. So these are the things that we see with the jaw and which needs to be corrected in growing children itself. That is around 7, 8 years and so on. Unlike the most common misconception that the alignment can be done only at 13 or 12.
Yes. Yes.
Yeah, so these are few things that we start earlier, but the habit making again can be started much earlier. So even when the child is around 4, it is better to evaluate the habit, see the frequency and intensity, and based on that decide on how to go about it.
Yes. Yes. So I think if things like this can be detected early and a proper jaw growth happens, and like you said, even if there isn't enough space for the adult tooth to come into place, if the jaw growth has been done properly, probably later a braces or a clip treatment becomes a little more easier to correct. Just the teeth correction.
Yes, in most of the cases, this myofunctional or this removable braces are not a replacement for the permanent braces, but they are setting the foundation correct. They are setting the jaw growth correct. So the later the teeth can be aligned better.
Better. Yes. Yes. Because I think later what we put as clips and do the treatment, braces or clip, is more or less only teeth correction. The basic jaw growth correction cannot be done at a later age. So it becomes, I think, really important, that parents, like you said, some conditions are inherited. It's genetic. Some people tend to have a little forward lower jaw and things like that. So I think if parents are, like that, they probably can expect, the child could be in that range. So I think it becomes helpful, that they get early on. So doctor, what do you think is the right age that they get, if they think they should expect something, what is the right age that a parent gets a child for an evaluation?
Doc, that's what I think. I will have to reiterate the fact that considering how our kids are, it could be cavities, it could be jaw growth, it could be alignment. It is better that we start the kids earlier at around 1 year, though cavity is more of a focus at that age. And moving forward, once in 6 months, once in 8 months, depending on the risk, we keep following up on the child. But alignment per se, I think 6 to 7 years would be good to start checking on the jaw growth, because that's the time when the transition is going to happen from milk teeth to permanent teeth. But if there is any associated habit, it is good to see the child at 2-3 years also, because that's when we can start evaluating on the habit and see if correction or intervention needs to be done now or later. But at least we should know there is a issue that needs to be sorted
out. So I think as a child grows, and as you check him very regularly, you'll also be able to notice the changes that are happening, and which direction it is going in. If it's kind of going to get rectified by itself, or it's in a borderline, or it's going into a severe case. Because I think I still have seen some children, what we call as micrognathia, what we call in our technical terms, the lower jaw being so small, like we say bird faces, we say, the jaw being so small. And sometimes I wonder, I'm like, oh, probably the parents were not aware, or they're probably thinking it will get rectified by itself a little later. But I think by the time the child reaches 12, 13, 14 years, most of the growth spurt is over, the bone has grown,
jaw growth is over. Yes.
So then what happens is I think doing a correction is a Herculean task later.
It is. I think later, if I'm correct, Doc, you know more about adult dentistry. I guess surgery would become the only option, right?
Not later. But during the teenage times, when the child has to feel that confidence, he misses
earlier. I think again, Doc, here it is because earlier, maybe when we were growing up, it was mostly fixed ortho.
Yes.
So this myofunctional or the jaw growth, jaw modification, maybe that concept was not that prevalent. So parents always think that the alignment or the jaw correction can be done only at 13. Or can be done only when the permanent teeth come.
Because I think when they were younger, that is how it was told to them.
That is how it has been. Exactly. Even for us, that's how it's been. So yeah.
Yes.
But luckily, because as pediatric dentists, now we see a lot of kids over the period of years, it has become easier for us to do the early intervention.
Yes.
Parents might have come for cavity, but when we see that there is a shortage of space, and when we explain, then the expansion can be done, and the results with the permanent alignment are very good.
Very good. Yes. I mean, I think the kind of changes that we can see, it seems like as if the child evolved into somebody so different altogether. When you see those changes that happen, whether it's an open bite or like even a cross bite, like you said, and the jaw growth, the discrepancies, when all of that gets corrected, and then you see the child at a later date, say 2-3 years down the line, and then you'll be so amazed to see those kind of changes.
I think when you're following up children with their alignment, that is the time, I guess it's a realization for us, how old are we?
No, but then it gives us so much joy, to see that magic kind of a change, and the amount of confidence the child gets, because of his new looks. And he's like, the child feels so proud. He feels so happy to smile. I mean, I think everything finally shows in the smile of the child, the way he hesitates and smiles, or, like he's like really smiling, he's like really happy.
And one more misconception is that, the alignment and all that is mostly cosmetic, but it's not the case, doctor. It has got a functional importance also. If the teeth are crowded, the hygiene is going to be compromised. And if the bite is not proper, eventually your TMJ is going to take the toll. So it is, you won't be able to chew your food properly if you're going to have a severe class 2 malocclusion. So it is, cosmetic part is what we see first, but there are a lot of other things that are involved with the alignment and a proper bite in growing children and adults as well.
Yes. So Dr. Premila, what do you think? Do you think the occurrence of such malocclusions is more prevalent in these days as opposed to the previous times? Like of course you said probably detection was not happening earlier. That could be one reason where not many cases were detected. But apart from that, do you think diet plays a role in this? maintaining oral hygiene. Again, like the way you said, a tooth lost can hamper the jaw growth, kind of a thing. Like we are shifting from, more coarse food to refined food. So is that in any way impacting the way the jaw is growing?
I think I'll need to read up on some studies on that, Dr. Rekha, but I do feel so. I mean, logically thinking and seeing the number of situations, like I think our generation didn't have space for wisdom tooth. Our
Yes.
parents had space for wisdom tooth. They are all, all they
Yes.
have, and they've never had wisdom tooth issues.
Yes.
But
Yes.
in ours, there in much younger generation, it's more common
Yes.
to have wisdom tooth issues. So
Yes.
I feel, that's how the kids' jaws are more smaller now.
Yes.
So
Shrinking kind of.
if I have to look at the number of children I'm seeing for expansion, I do see a increased number now, but I don't know whether it is really the jaw becoming smaller or it is the increased awareness.
Awareness. Yes.
Yeah.
Yes.
So, but yes,
Possibly both. Possibly both.
both. Yeah, possibly
Possibly
both.
both.
Yes.
Possibly both.
Because parents, they like, my teeth are fine, my husband's teeth are fine. Why is, child's all crowded kind of a
But
thing.
I
But
think
yes,
that again attributes to, what we call as the jaw length tooth material discrepancy. The child inheriting the jaw size from one parent and the tooth
and
size from another parent.
yes,
That happening also.
yes, that is sure one of the reasons that we can think of. But in a child without any habits, I do feel the numbers of smaller jaw and larger teeth are more nowadays.
Mm. Mm.
More refined food could be one of the causes.
I think the children don't chew enough. There's not enough, what do you call, coarse food that they eat on. Everything is soft,
More
nice,
processed. Our
sizzling.
diet is becoming more
Yes.
processed. Now the corns are also cup corns. The sugarcane is a juice.
I know. There's no work for the teeth.
Yeah, so I guess the jaws are becoming smaller.
So would
But
we be
yeah, the most
surprised?
important point of this discussion is talk that early intervention
Yes,
can,
yes,
help in a long
yes,
run. So it is
long run,
not
yes,
13. It is better to see the child early, even if it's
yes,
only for the alignment.
yes, yes, yes. So I think that was a very interesting talk, and Dr. Premila, thank you so much for sharing all your experiences, and reinforcing the fact to our parents, that probably a routine dental checkup, even for their child at an early age, starting early on, kind of helps in, treating and, intervening a lot of malocclusions, that can possibly occur in later life for the child.
Correct. Yes, yes. I think for everything, early intervention plays a very important role. It could be cavities, it could be alignment, it could be, checking on the child's jaw growth. So it is better.
Yeah. So thank you so much for joining me in today's Two Talk conversation, Dr. Premila. And I really hope I can get you back to do another discussion on another interesting topic on child tooth care.
Sure, doc. Anytime.
Thank you. Thank you so much.
It's been fun talking to you, Dr. Rekha.
Thank you.
See
Sure.
you.
See you. Bye. Hey viewers, that was Dr. Premila, periodontist, who did talk to us about the importance of early intervention and early checkup and care in your children. I hope that talk was helpful. And if you have any doubts or queries, please do write to us and we will get back to you on that. So until next time that I come back with another dentist with another topic for discussion on your oral and dental health, keep smiling, stay safe, and be happy. Thank you.